Have you been thinking about progesterone, curious about progesterone? Maybe your healthcare practitioner told you it's time for progesterone or suggested progesterone. This is the video for you. We're going to talk all about the different progesterone therapies that are out there. We're going to talk both about what you can get prescription at your typical pharmacy, what can you get over the counter, and what do you need compounded. Hi, I'm Dr. Carrie Jones. I am a women's health and hormone expert. Hormones can feel like herding cats, and I am here to help. So make sure you hit that subscribe button because I'm going to cover all this information and more. First and foremost, we have a couple caveats before we get started, but in general, the order we're going to go, just so you're aware, I'm going to cover oral capsules first. Then I'm going to get into the sublingual. They're commonly called troches or troches. We will cover creams and gels. We will cover the vaginal application. We will cover the injection. Okay, so the first caveat when it comes to progesterone is that when you get your blood drawn, if that's the route you choose to go, usually with progesterone, we can tell, if you still cycle, that an ovulation release of progesterone occurred if your progesterone values are above 3. Sometimes the hormone societies say above 5, or fertility experts will say above 5, but really above 3 is what everybody agrees on. So if you get a blood draw and it's 6, 8, 9, 10, you have ovulated. Now, it doesn't necessarily mean you've ovulated and produced progesterone well. You still may need to optimize that, but above 3 is what we're looking for. If you're postmenopausal, don't have a cycle, or maybe late stage perimenopausal, you've been skipping a lot of cycles, you may definitely find your progesterone is below 3. It could be 1. It could be lower than that. When it comes to fertility, when it comes to good ovulation, good production of progesterone, we want it to be above 10. 10. And even some people say above 15. So when you're getting blood drawn, I'm going to stick with that because there are a lot of other options out there, urine, saliva, I'm aware of that, but blood seems to be an easy gold standard to talk about for everybody. So if you are between above 3 and 20, then you have ovulated and you're producing progesterone. Now, here's where progesterone can go down. Obviously, perimenopause. If you have PCOS in your skipping cycles or haven't had a cycle in a while, if you have amenorrhea, if you have a lot of stress, if you have an anovulatory cycle, if you're postmenopausal, right? There are a lot of reasons for low progesterone that might cause you to want to go on progesterone. And I actually even have a whole other video on progesterone that you can watch. The next caveat is I'm only talking about progesterone. I am not talking about the progestins that are synthetic. I am only talking about progesterone options, like the progesterone that comes from your ovaries, should you ovulate. The third caveat is I will be talking about compounded progesterone, and I will be talking about over-the-counter progesterone. So I'm going to give you all the options. There is some interesting information out there on compounded medication, compounding pharmacies, because the end product is not FDA approved. If you get a compounded progesterone capsule and you can't use or you're allergic to the fillers and binders in the typical capsule, which is peanut oil, which I'm going to mention in a minute, let's say you're allergic to peanuts, you have to get it compounded, then you go to an actual pharmacy that is a compounding pharmacy made by a pharmacist, an actual pharmacist, and they will use actual FDA-approved progesterone. It's called progesterone USP, and they will make it into a pill, in this example, without peanut oil. So the end product is not FDA approved. However, it is a real pharmacy with a real pharmacist using real progesterone. So I do want to give that clarification when people say online, oh, but it's not FDA approved. And that's true. It's not. It's the end product is not. But the pharmacy, pharmacist, and raw ingredient are what you would expect the hormone, in this case, progesterone, that you're looking for. Okay, let's dive into oral progesterone. So we have the prescription trademarked branded progesterone out there that is known as Prometrium. Prometrium does have peanut oil in it. It does have some binders, fillers, and food dye in it. I believe it yellow and red. And depending on the amount, you can read the ingredient list. So if you are red dye sensitive, you do want to be careful, of course. It comes in 2 doses, 100 milligram or 200 milligram. That's it. You can't change it. And that is probably the most commonly prescribed progesterone out there. You'll get Prometrium. You will get 100 or 200. You will take it at night as indicated. And this 100 or 200 milligrams, you take it at night as indicated. Then you can get that compounded, as I mentioned. You cannot get oral capsules over the counter. You cannot buy this off of Amazon, but you can get it compounded if you're allergic to peanuts. If you cannot do red dye, as an example, if you don't need 100 milligrams, you need 50 milligrams. They can make it specifically for you. If 200 milligrams is too much, you need 150, they can compound that specifically for you. So these are your options with that your healthcare practitioner may talk to you about. When we talk about oral progesterone, it's called oral micronized progesterone, OMP. So whether you're getting prometrium or you're getting it compounded, it doesn't matter. It's the same raw ingredient, oral micronized progesterone. So if you see that on the prescription label, if somebody mentions that to you or they call it OMP for short, that's good. That's what you want. It's bioidentical. It looks like the kind your ovaries made. All right, let's move on to sublingual. Sublingual progesterone, there is not a sublingual that you can get that is an FDA-approved, branded, trademarked end product like prometrium. You can only get it compounded when you're doing with the prescription with your healthcare practitioner. So sublingual is exactly what you think. Picture like a breath mint that you would put under your tongue or in your mouth or in between your cheek here, like your gum in your cheek, and you let it dissolve. Oftentimes it is called a troche. Troche, troche, or troche, it is sometimes referred to as, and it is a dissolvable. So some will get into your bloodstream right away, and then some gets in your saliva, and you end up swallowing it, just like a breath mint, right? So you suck on a breath mint, some of that gets right into your system, and then the breath mint part mixes with your saliva. That's not going to get absorbed up here in the gum mucus area, and that's going to get swallowed. So it's this combination, sublingual, combination oral, when we're looking at a troche or a troche. They can make them in a variety of flavors. They can make them in a variety of sizes, depending on the milligram amount in there, and they can make them in a variety of milligrams. Okay, let's move on to creams and gels. When it comes to creams and gels, there are no FDA-approved creams and gels. However, and this is what by creams and gels I mean topical, like a progesterone lotion that you would rub on. You can find these over the counter, and the reason for that is the FDA views them as cosmetic. And because they're viewed as cosmetic, there's no need to have, it's not FDA approved at Costco or Walgreens or, Kroger. They don't go that route because of the creams and the gels. They are compounded instead, or you can find it over the counter. So the compounded is nice because it does come, you can change the amount, the milligram amount in there. It comes in a variety of ways to dispense the cream. Instead of being just in a tube, you might have something that clicks, or like a pump lotion. You may have it in a syringe with no needle, and you can just push out the amount you want depending on the line on the syringe. And then when you apply it, whether it's a cream or a gel, you apply it. Generally, it's suggested to apply to thinner skin. So inner arm, elbow, behind the knees, wrists. Oftentimes you'll see that in the instructions. Now the over the counter are different. Over the counter you tend to see, and you can get them online at Amazon. A number of companies are making them. I've seen them at Whole Foods or other holistic or more natural food stores. And it can come as a pump, or it could come as a tub that it'll say like a teaspoon or a small amount, a dollop. It's interesting to read the instructions. And then again, you could rub it into your skin. And each amount is usually roughly about 20 milligrams when you do it over the counter like that. Not always, but that's probably what I see the most often. So creams and gels. There is a caveat to creams and gels, or these topical progesterone, is that if you are on estrogen and you do have a uterus, research has not shown that a cream or a gel, a topical cream or gel, is going to protect you against what we call uterine hyperplasia, a thickening of the inner layer of the uterus. So if you have been suggested you're on estrogen, you have a uterus, and they say, let me prescribe this progesterone cream for you, it has not been shown, it is not suggested, it is not recommended by the big hormone societies and by research that it will protect you against hyperplasia. What has been shown to be protective is oral progesterone that you swallow at the 100 or 200 milligram dose, or vaginal. Now, I don't want you to confuse topical with vaginal. Some people associate vaginal progesterone as if you're applying it to the outside. That's not what I mean. That's labial. or at like the topical part, you know, the outside of the vagina. I'm talking about up inside, when you're pushing something up inside, cream or a suppository, that skin is different up there. And if you insert it up inside, that has been shown to be protective. So when I say topical cream or gel for progesterone, that has not been shown to be protective. If you have had a hysterectomy, you do not have a uterus, then you can use the progesterone topical cream or gel. And I know it can be very confusing, but I do want to point out that the thickening of the lining of the uterus, called hyperplasia, we're trying to avoid if you're on estrogen. Now, if you're listening to this and you're not on estrogen, you just want progesterone. Carrie, I just want progesterone. I just want to start with progesterone. You absolutely, if your doctor says, your healthcare practitioner says, it's time for progesterone, or let's look at progesterone, your labs indicate progesterone, then you can start with the topical progesterone cream or gel. But once you go on estrogen, and if you have a uterus, you have to switch vaginal or oral, and oral is the most preferred. So that's everything with topical progesterone. So let's move on to the vaginal application of progesterone. Vaginal progesterone has been made popular with fertility treatments. So it's suppositories that are, or tablets that can be inserted up inside the vagina that then melt and get absorbed into the system. It is prescription, although it can also be a prescription, as in, I should say, trademarked, branded, because they started out being quite popular for fertility, and now they have been found to have use for late perimenopause and menopause progesterone. You can also have them compounded at a compounding pharmacy. So the vaginal progesterone route is definitely an option. Pros and cons to this. Pro, it can help, depending on the dose, it can help protect against uterine hyperplasia. The con is that some women do not like to have the vaginal suppository or tablet up there if it leaks out, or if they are sexually active and it can get in the way of spontaneity, because you don't want to use the hormone as a lubricant with your partner. You don't want that to get onto your partner. So you do want to plan ahead, keep that in mind with the vaginal. Other women love the vaginal because they insert it at night before bed, they fall asleep, and it's like no muss, no fuss. They don't have to worry about it. So to each their own. I do want to give you some pros and cons with that. And that leads us to the last one, injectable progesterone. Now, injectable progesterone can be a full-on intramuscular injection, or it can be a subcutaneous injection. So right into the muscle, or kind of sort of like just under the skin in the subcutaneous layer. Again, these routes, specifically the intramuscular progesterone, became popular in the fertility world. If you have gone through IVF, then you probably got progesterone injections as part of your cycle. They realized this could also be helpful for the late stage perimenopausal, menopausal women who prefer that route. They could do intramuscular or compounded subcutaneous progesterone. So again, not as common. However, some women love it because it's quick, it's easy, and then they can just do their injection. The subcutaneous can be more like daily, or, you know, more often, I should say, whereas the intramuscular may be less often because it's a bigger dose in the muscle, and it may only need it once a week or once every other week. And so with doing the intramuscular, the injections, there are options that you can get that are branded, trademarked, et cetera, or that you can have compounded. So there's all of your options. We have oral, we have the sublingual, we have the topical gel or cream, we have the vaginal, we have the injection or the subcutaneous. So you do have a lot of options. There are no patches. There are no even compounded that I'm aware of progesterone patches. And there are no similar like rings. So for example, there is an estrogen ring called an S string that can be inserted up in the vagina. There is no progesterone ring that can be inserted up into the vagina. And there is no progesterone IUD. There is a progestin IUD, the Mirena, the Skyla, the Kylena. That's different. That's the synthetic progestin that we're not talking about today. We were talking about just actual progesterone today. So I hope this was helpful and deciding between, oh my gosh, there's so many options out there. I will say, because probably the most common question I get is, well, what's the most common form? What's the most common route? I would say in my experience and observation, watching through thousands of comments on social media, oral progesterone is the most common I'm seeing now. Oral progesterone is the most common. Let's pretend you just want progesterone. You don't want estrogen, or you're not ready for estrogen. you're not there yet, you just want progesterone, then I would say it's a toss-up between the topical, because women will buy it over the counter, or their healthcare practitioner will compound it for them, or they will do the oral. They will do the capsules of progesterone and just start there. If you are also on estrogen and you have a uterus, then oral is the most common as opposed to vaginal progesterone. If you don't have a uterus, then oral is still, but you're doing estrogen. So estrogen, no uterus, oral is the most common. Estrogen with a uterus, oral, or vaginal, but oral is still the most common. So I hope that helps. Or in the end, oral seems to be the most common. It doesn't mean that has to be the most common for you. It may not be the route that you like. You may prefer the subcutaneous injections. You may think that the no muss, no fuss, inserted at night, go to sleep, not worry about it, may fit your lifestyle better. You may have tried the oral and not liked it, so you switched to a sublingual. But I just want to tell you what I see out there in social media land and what I see with patients when I'm talking to practitioners all over the world. I'd say that's probably what I see the most common. Oral is the most common regardless. And then the topical creams are the most common if they're not doing estrogen and just want to start somewhere with progesterone. So there you go. There's your quick down and dirty breakdown. And this, of course, there's a lot more nuance to this. You are absolutely going to talk to your healthcare provider. You are going to talk to your pharmacist about this. But I wanted to give you a quick snapshot when it comes to all of these, because it can feel confusing. It can feel overwhelming. And now you understand the difference between getting it compounded, getting it like from a conventional pharmacy. What can you get over the counter? What are some pros and cons? What does it mean to be FDA approved? Is a compounding pharmacy legit? Some of these questions that I've just seen out there. So I hope this was helpful. Again, my name is Carrie Jones. You're going to want to hit that subscribe button because I said in the beginning, hormones are like herding cats, and I am here to help.